Okay, now it's on. Thank you very much. Hi, welcome. I see that very many of you are very comfortable in the back, but if you would bother, I would really encourage you to come forward because it's so much nicer for the speakers to have like a crowd closer on, and it will create a much more nice, familiar, intimate atmosphere. So please come forward. Today in this session we will hear about cannabis policy and about the various pilot projects, and we will explore how harm reduction potential of cannabis and effects of regulating cannabis can have on user behavior and public health. My name is Anniken Sand. I come from the city of Oslo. I'm also the chair of the working group on substance abuse and prevention and harm reduction in Eurocities. So if your city is part of Eurocities, then send someone to my group. That would be nice. We will try to have like 1 or 2 questions after each speaker. And then if you're not comfortable asking any questions, please do ask questions in the app, and then I will read it. And after everybody has presented, we will of course have a round of question and answers. So, as you can see, our first speaker is going to speak about opportunities for harm reduction in emerging European policy regulating cannabis. Dr. Thomas Martinelli is a PhD in recovery working on the Trimbos Institute in the Netherlands, in the program Drugs Monitoring and Policy section, or something like that. So, yeah. And he will speak on the basis of a research of mapping cannabis policy development globally. He has been looking at underlying policy goals and the process of policy development and the role of harm reduction strategies in policy development. The floor is yours.
Thank you very much. So I'm going to talk about opportunities for harm reduction in emerging cannabis policies. And I have to be upfront with you, it's kind of an idea that I'm still working out. So I'm kind of hoping to take this opportunity to, maybe some of you can help me work it out, because as normally with an idea, I talk to people who are smarter than me. So I'm hoping you can bear with me and think with me on this idea. First, I will explain a bit where this idea came from, which Annika already explained was based on a research that I was doing. Then I will share some things that came along the way while I was discussing this idea with my colleagues. And then in the end, I want to come back a little bit about to the idea, if we can maybe advance the idea. So, first the idea. It came from research that I was involved in together with Brand Europe, in which we basically mapped all the international developments around cannabis policies from the last 15 years, more or less. And just for a basic scope, we were only looking at recreational cannabis, so not medical cannabis. And we were looking at policy developments dealing with supply regulation. So it was the regulation of the cannabis supply and only policies that were implemented in laws, so not just decriminalization or tolerance policies. So if we then look at the world, like what was happening in the last 15 years, you can see that the first developments, there were a couple of states in the United States from 2012. Now there's 25 states, and they're mostly commercial models with how they regulated cannabis. Then 2013, Uruguay was the first country to legalize cannabis. There you see also some other models, some non-commercial models of cannabis supply. Then followed Canada with a federal legalization, legalizing cannabis across the country, but giving the opportunities to provinces and territories to develop their own local cannabis policies. Then Canberra in Australia, legalizing home growing. And then we come to Europe, 2021, the first European country to legalize home growing and clubs, Malta, which we will hear more about later. Luxembourg, also home growing in 2023. And last but not least, Germany, which we will also hear more about, with a plan of home-growing clubs and maybe also retail, but I think that plan was already revoked recently, so let's see what's going to happen there. So basically, oh yeah, don't forget Switzerland with their pilot laws. They didn't regulate cannabis supply yet, but they implemented a law that made it possible to do experiments with legal supply of cannabis. And then the Czech Republic also with plans for regulated supply, but we're not quite sure what's going to happen there. In our research, we mapped out all these different developments, and then we zoomed in on a couple of case studies, because our job was to gather lessons for the Dutch cannabis policy, which is right now also doing an experiment with regulated cannabis supply. So we're trying to look at case studies that might be relevant also for the Dutch case. And now we really delved into why cannabis policies were changed, what were the goals, what were the underlying goals, how did these processes develop. And these gave us some ideas. And I think in general, our findings were about policy goals. Some of them were explicit, others were implicit, but they were mostly around protecting public health and safety. And they did this through certain rules for access to cannabis, for example, but also through supply models. And this was kind of where the idea came from that I want to discuss today. Because if you're talking about protecting public health and safety, you can also think about it in a way of reducing harms from the policies that are already there. So I kind of started with this idea, well, a lot of the rhetoric and a lot of the language in these cannabis policies, they seem to fit the harm reduction philosophy, the harm reduction principles, but they're not very explicit about it. Rarely the word harm reduction came up in the policies that we analyzed. So I thought that was interesting, like why isn't this happening, and are there maybe opportunities to include this harm reduction narrative there? So then, as I discussed what I did, I talked to my colleagues who are smarter than me and talked about, okay, so if we're talking about opportunities for harm reduction in cannabis policies, what are you thinking of? And broadly, my colleagues came up with three things that were about safer consumption methods, safer products, and safer behavior. So to give some examples, I cannot provide too much examples because of the time. But safer consumption methods, you can think about, for example, about vaporizing instead of smoking, so you don't inhale burned plant substances. You can maybe think about taking oils instead of smoking cannabis, which also reduces some of the harms from smoking. If you think about safer products, you can, for example, think about products with lower THC. You can think about edibles. The funny thing we came across in Quebec, the edibles they try to not make them attractive for children, so you would have like beets or cauliflowers infused with THC. It's kind of interesting finding. But you can also think about quality control, for example, so to make sure that cannabis is not polluted with anything that's not supposed to be in there. Also talked about safer behavior, so for example, educating people about safer use, about, for example, not combining it with other substances and the risk related with that. Maybe also educate people about driving and cannabis, and educating like how long does cannabis work and stay in your system, and how long are you under the influence. And these are all things that are aimed at reducing the harms from cannabis use. So I thought it was interesting, because if you look at the cannabis policies, they're not that much aimed at reducing the harms from cannabis use. They're more aimed at reducing the harms from cannabis policies. So I thought that was an interesting distinction when we thought about it. So if we look at the policies, they try to reduce harms through supply models. So for example, in Quebec, they try to limit the commercialization of cannabis supply. They have a government monopoly on the sale of cannabis, and they're saying, well, we try to keep away the industry so we can protect the public health that way through a supply model. For example, another way was to provide access to disadvantaged communities in the cannabis market. This was a case in Vermont, for example, where the communities that were most impacted by criminalization got the first access to being able to sell cannabis. So it was more like a social justice type motivation to change. Another way was to sell cannabis in a controlled environment. So, for example, in Switzerland, where they had, or in Uruguay, where they had a model of selling cannabis through pharmacies, where it's quite controlled, and you have educated people who can also give some advice, and you have some rules of access restriction. 2 minutes, yeah. I'll come to my point now. Thanks. And there's more examples of this. So, because I have 2 minutes, I won't go into more examples. But as I said, so we have these different reduction of harms. But one of them is focused on the harms of cannabis use, which is usually what we think about. If we're asking my colleagues about harm reduction in cannabis, that's what we're talking about, of cannabis use. But then you can think about it, well, is that really the problem? Is cannabis use that harmful, you know? Is that really the problem of cannabis? And if you look at the cannabis policies, they are aimed at reducing harms from cannabis policies. So we're talking more about the harms of prohibition and criminalization, for example. So, and this is the idea I'm still working out. So if you have more ideas on this, like what does this mean? What can we learn from this? I think these new cannabis policies, they help us highlight the harms of drug prohibition. And I think it's a way also, I'm noticing now, for example, if we are talking about the initiative of Amsterdam and the mayor of Amsterdam talking about regulation of other substances. You can look at the cannabis case and kind of see, like, well, what are the arguments of regulation, and maybe it can also apply to other substances. New cannabis policies, they show how certain supply models help to reduce harms. So it's not just reducing harms of use, but also reducing harms of the setting in which substances are distributed or supplied. I think new cannabis policies, they provide new narratives for policies grounded in harm reduction principles. So even if they are not explicit about it, I think much of the narratives in cannabis policies, they actually fit the harm reduction principles quite well. Yeah, so as I said, maybe there are more things that we can learn from this, and I'm also really interested if one of you is in here, but cannabis is different, and please, I'm very welcome to your critiques, and please shoot at my idea, because hopefully it will make it better. And one last opportunity is, I wanted to discuss this, because we are now working with the EUDA, Trimbos and RAND together, to develop tools to support member states in the EU to develop cannabis policies, but also to help them evaluate cannabis policies, and everything related to that. So this is a project that we will be starting next year, and maybe we can also use some of these ideas to help develop these tools to support the EUDA, to support the member states. So that was the end of my presentation.
Thank you. That was super interesting to hear also a bit on your kind of view on not only the use, but also the harm reduction of the actual policies. Are there any questions?
Thank you. My name is Alex Stevens from the UK. Thanks, Thomas, for presenting this idea of cannabis harm reduction. You asked for suggestions. My suggestion is that you look at tobacco harm reduction as the closest model, rather than as the harm reduction which is traditionally grown up in the drugs field from injecting drug use. We're talking about smoking. And the biggest harm that we can reduce in tobacco harm reduction is the harm of smoking. And the biggest harm we can reduce in cannabis harm reduction is also the harms that come from smoking. And so therefore the biggest thing we can do is move people away from smoking the weed to consuming it in less harmful factions. The problem with that is that that's a rational scientific argument, and these are not rational scientific debates about drugs or about tobacco. You see massive opposition in both drug harm reduction and tobacco harm reduction to the very idea of people using these substances. Especially in the tobacco harm reduction, you see massively irrational opposition to vaping. So yes, let's think about reducing smoking, but let's not pretend that that's going to be easy because of the moral opposition that will come to the idea of tolerating the use of these substances.
Yeah, thank you. I saw you sitting there, Professor Stevens, and I was hoping that you would comment on my ideas because, yeah, you are the expert in this field, and I think you're right. And the smoking is, of course, well, it is related to the use, but I think it's also interesting how you see that these two policy fields are going in different directions, right? So smoking is really going towards prohibition, and in cannabis we're going more towards legalization. So I was also wondering, maybe if you know, but is this idea, hasn't it already been thought of, you know? So, yeah.
Okay, one more question. And then
Maybe we can talk about it later after that.
Just a quick note on terminology, which occurred to me because you talked about cannabis and you talked about smoking, but cannabis is smoked and cigarettes are also smoked. So maybe we need to start using, smoking nicotine and smoking cannabis in the sense of just different substances we smoke, and not because cannabis use, I don't know, for me at least, it gives me a sense of something which is something much more dangerous than you use a drug than other than just smoke. So maybe we shouldn't start. We should start thinking about just because it is smoking, just different substances, just smoking cannabis and smoking nicotine. But it's really the same.
So
It's the same in the sense that, yeah.
So I think your suggestion is just burning plant material and inhaling it. That's the thing that we should be. Yeah. Oh, that's a good point. Yeah.
Okay, we allow one quick question.
Yes, I fully agree with the opinion that the strong opposition towards tobacco harm reduction is irrational. But in cannabis we have, I would say, starting irrationality also towards edibles, right? And comparing the smoking and eating, the products from eating, it's more natural and less harmful, yeah, way. But we have very strong opposition towards edibles in cannabis regulations. I mean, with reference to protection of minors and so on, which is also kind of irrational if it's too much or too strong, yeah? What do you think about that? Just to have a question.
Yeah, it's a good point, and there's lots of incidents with young people or children ingesting edibles and ending up in hospitals, of course. And I like the example from Quebec where they make very unattractive edibles. That might be a solution in this field. Yeah.
Okay, thank you very much again. Our next speaker is French. Martin Bastien is a PhD student looking at the experience of people who use cannabis as a self-regulating strategy. The research is how cannabis can be an effective harm reduction tool to substitute other substances. I'm very excited to hear what you're going to say. The floor is yours.
Hello everyone. I just finished my PhD 1 week ago, so I'm glad to present. Thank you. I'm going to present to you a part of my PhD work. So basically my PhD is on non-problematic and beneficial use of cannabis. So I'm not going to talk about regulation, but more about self-regulation practices adopted by people who use cannabis in France. So my main message is that, yes, harm reduction tools and advices for cannabis use are important, but cannabis use can also be a harm reduction practice for some individuals. And I think that formal regulation initiatives could facilitate those informal self-regulation practices. So, a bit of context. Cannabis is the most widely used illegal substance in France, with half of the general population who declare a lifetime use of cannabis. And 6% who declare last month use of cannabis. We can observe statistical association between cannabis use and other substance use. We used to hear about gateway theory, but I'm definitely not convinced about this theory. Another element of context is the ongoing medicalization of cannabis in France, but with very limited application, very strict criteria. For example, just for multiple sclerosis or cancer pain, but we can observe a lot of self-medication practices with cannabis who are very broader than the criteria for medical cannabis in France. For example, for acute pain, mental health, sleep quality, and self-reported data from North America highlights a particular practice about the cannabis substitution hypothesis. So this cannabis substitution hypothesis is a topic of interest for some French community-based harm reduction organization who contacted us to talk about this practice they observed among their members or the public. So we decided to conduct a survey on this practice to identify and describe the profiles and the perceptions of people with cannabis in combination or in substitution with other psychoactive substances. First, we conducted an online questionnaire surveys where participants were recruited through community social medias. The criteria were to live in France, to be older than 18, and to declare having used cannabis to manage, to reduce, or to quit other psychoactive substances, either prescribed or not. And we focused only on opioids, alcohol, stimulants, and benzodiazepines. Then I conducted qualitative interviews, face-to-face or by Zoom. We recruited 11 participants from the previous questionnaire and the 10 others from snowball sampling. And I conducted a thematic analysis specifically on their experiences with other substances and their experiences with medical system. Okay, so 2,030 participants completed the questionnaire. They reported mostly replacing opioids and alcohol with cannabis, but 1/3 declared more than one substance. Participants were mostly men with no specific age group. And we observed a specific profile of people who use cannabis compared to general population surveys on cannabis use, because 74% were daily users. A quarter reported home cultivation practice, and 13% reported non-smoked modes of administration. Between 23% and 59% consulted a health professional for dependence, mostly for opioid and benzos. And between 63% and 78% declared having reduced or stopped successfully the substance thanks to cannabis. Then, so the first theme was presenting cannabis as the drug of choice. It was perceived as a safer alternative for most participants. The cannabis for some participants is a more effective medication. For example, this man with anxiety and depression in the past. I have to read that. I don't feel any beneficial. Yeah, okay. I think you have read. Then cannabis was reported as a drug with fewer side effects but also than illegal drugs, but also alcohol and prescribed medicine. For example, this woman with multiple sclerosis who really perceived cannabis as safer the next day after consuming, but with alcohol she feels very bad the next day. And many participants reported distrust of chemical products in opposition to natural organic products. And so some of them declared to stay away from all they call the chemicals. Often chemicals are what they call also hard drugs. I hate these names, but it was reported as this. Oof. Okay. So cannabis was also presented as a harm reduction tool with a variety of effects and motives. First, cannabis, for some of them, can be used in substitution to therapy to replace the therapeutic or recreational effects, but it also can be combined to manage or to improve the drug effects. And it also can be used to manage withdrawal symptoms for some participants who tried to quit the substance. So I can't provide any recommendation only on my data, but I think it can inform some regulation policies. First, I wonder if cannabis could be a therapeutic option for problematic drug use. We obviously need clinical data on that. But it also brings an interesting concept of non-abstinence recovery, where cannabis could be a substitution treatment, not like COAT, but kind of, or just an adjunct treatment to improve well-being. I also wonder if we can extend the medical recommendation for cannabis. We could provide a pragmatic, safe supply for and medical supervision for participants who are already self-medicating. Okay. And I also wonder what would be the impact of regulated access to cannabis on the general trends with other drugs, on overall other drugs use, but also on associated problems, and it needs economical and epidemiological data to confirm or not. Okay.
Thank you.
Thank you.
Any quick questions? Okay, save your questions for the end. Okay.
Hi everyone, I'm Ligia, I'm from Euronput, and listening to Martin, I just wanted to say that I know numerous testimonies of friends that are doing substitution with cannabis for several substances, including heroin. So this is only to comment that I know some stories, okay?
Thank you.
Thank you, thank you. Thank you very much, Martin. Then we will move on also to a French-speaking person. Maëlle Bisson is a PhD student and a psychologist and is here to present how a pilot project regulated and affected the use of cannabis with more than 700 participants. It's still ongoing research, and the floor is yours. I'll get this up because we don't have any helpers, so I have to do everything.
All right, hello everyone, good afternoon. My name is Maëlle Bisson and I work at the Geneva University Hospital in the Division of Addictology. I am here today with my colleague Tamara Corino, so she will be available to answer any of your questions afterwards. So I'm also here to talk about the Geneva pilot trial that is taking place in Switzerland. All right, as you may know, in Switzerland, cannabis consumption, production, and sales remain prohibited. However, despite this prohibition, the consumption is widespread and the black market continues to thrive. The current legal framework has neither reduced cannabis consumption nor improved public health effectively. To address this, the Federal Office of Public Health has authorized cannabis pilot trials under strict regulations. The main goal of these trials is to assess how the access of cannabis, regulated access of cannabis, has an effect on public health and society, and to provide a scientific basis for future legal regulations. As shown on this map, cannabis pilot trials are taking place in many places in Switzerland, but today we'll focus on the Geneva pilot trial. So this project is managed by the non-profit Change Association, which is responsible for conducting this pilot trial. Change supervises two key mandates. First, the production and supply of cannabis, and through local and organic cultivation. And second, the sale of these products through the official point of sale, La Cannabinothèque. Importantly, all profits generated are used to finance youth protection measures as well as prevention programs. So this pilot trials underscores a risk reduction approach through two key areas. First, through the cannabis products themselves, and second, through their accessibility in the store. Regarding product-related measures, the project provides access to cannabis products with low THC levels that are organically and locally cultivated, as well as full transparency regarding product composition, including THC and CBD levels, as well as plant varieties. Moreover, alternatives to smoking, such as vaporizers and oils, are available to promote safer consumption methods. In terms of access-related measures, a nurse is present on site to address health-related concerns and questions. Sales staff are trained to offer safe and guidance. Also, prevention measures, including flyers and educational materials, are available. Moreover, strict measures are enforced to protect minors and prevent unauthorized access. All right, now let's dive into the material and methods of this project. So potential participants first register for an inclusion interview with one of their research assistants. Then they need to answer self-reported questionnaires at home. To be eligible, participants must be 18 or older, reside in Geneva, and use cannabis recreationally at least once a month in the past 6 months. Participants are excluded if they are pregnant, breastfeeding, have severe medical or psychiatric conditions, or have undergone an addiction treatment in the past 12 months. If they meet these criteria, they are welcomed in the study and have access to La Cannabinothèque. Please note that this is an observational and longitudinal study with data collected every 6 months for a period of 3 years. This means that in order to remain in the study and have access to La Cannabinothèque, participants must answer to the self-reported questionnaires every 6 months. Currently, we started this study a year ago, and we have 2 more years ahead, and we are collecting the 3rd round of questionnaires from participants enrolled a year ago, and more than half of our sample has completed the 2nd round of questionnaires, so after 6 months. When we look at the descriptive data, our total sample, so at enrollment, consists of 1,163 participants. So this represents the individuals that have answered to the 1st round of self-reported questionnaires. The mean age is of 38.3 years old, with participants ranging from 18 to 79 years old. The vast majority of participants, so 77%, are male. Regarding education, 57.2% of participants hold a higher education diploma. And in terms of professional activities, 66.1% of them are engaged in full or part-time work. Our sample is divided into 3 categories of income, so low, middle, and high, which we will discuss in the results shortly. In terms of consumption habits, participants, so more than half of the participants consume cannabis at least 4 times a week. Before getting to the results, I just want to quickly present our main outcome, which is the Cannabis Use Disorder Identification Test Revised, also known as the QDID-R. It is a screening tool that is used to assess problematic cannabis use in the past 6 months. To do so, it evaluates the frequency of use, the duration of intoxication, memory and concentration problems, as well as difficulties in coping with the social environment and social consequences of cannabis use. All right, I am now presenting some results on our total sample, so from the data collected at enrollment. For this analysis, we focused on the QDID-R scores and the income levels adjusted for the age. What you can see on this graph is that the QDID-R score varies differently and significantly across the income levels. Basically, the pattern of cannabis use is different from one income group to another. More precisely, the lower the income, the higher the QDID-R score, and the higher the income, the lower the QDID-R score. Additionally, age is also significantly linked with the scores of the QDID-R, underlying that the youngest the participants are, the higher they score on this screening tool. By the way, we also did linear regressions that shows that age and income are good predictors of the QDID-R scores, as they explain together 60% of the variability. So as I said before, more than half of our sample reached the 6 months time point, so we decided to see what happens after 6 months, so after the access to La Cannabinothèque. So this is what we obtain when we conduct repeated measures ANOVA. So here you can see different income groups, with the blue one being the low income group and the red one being the high income group. The evolution of cannabis use is different depending on the income group after 6 months. The higher income group increases significantly in their score of problematic use, which is not found in the other two groups, so the middle and low income group, that remain stable. So not only is the pattern of cannabis use different from one income group to another at enrollment, but they also evolve differently in time. So please note this is the actual situation, but of course it may change and evolve as we await data from more than half of our a little bit less, than half of our sample. Moreover, a study is conducted for a period of 3 years, so these patterns can change across the different time points. And this is our goal, actually. We want to see and assess how cannabis use evolves over time across different socio-demographic and economic groups. Future analysis and longitudinal data will provide more insights into the effects of regulated cannabis access. One hypothesis for the increase in problematic cannabis use in the high-income group is that the legal access facilitates consumption, removing the need to rely on the black market. Additionally, although prices at La Cannabinothèque are comparable to those on the black market, there is still a little bit higher due to better product quality and safety. We hypothesize that La Cannabinothèque mirrors trends that we can observe in countries and states that have legalized cannabis, so consumption initially increases before stabilizing. Our data also indicates that young adults in the low-income group are most at risk of problematic cannabis use, and this provides us a direction for shaping prevention and harm reduction policies and strategies. So thank you very much.
Yes, we have a question.
Thank you a lot. I have a question for you, but also for the previous intervention by Martin. Cannabis is one of the products that is used almost equally by men and women at the experimentation state, at least. So why do you have, from your point of view, a 77% of male?
I think that when we have our interviews with the future participants, a lot of male participants that are in a relationship with a woman that also consume cannabis, they have the habit that the man goes in the street to buy cannabis. So the man is the provider in a way, and the woman consumes cannabis through her partner. And I think that maybe women are most stigmatized when they use cannabis, especially when they are mothers. So the women that we have that are mothers, they feel like it was difficult to come for this inclusion interview because they're judged a lot more than their partner.
Thank you. It's two more questions. Be quick. So.
Hello, thank you for that. Steve Rolls from the Transform Drug Policy Foundation in the UK. There's always been a challenge when you're using survey-based data comparing before and after a legal change because of the degree to which people are willing to be open and honest about a risk behavior given its legal status. So generally they will be less forthcoming when something is illegal and potentially results in a criminal conviction or arrest. They may be afraid to talk about it. Is there any way to quantify, and this is for all of the speakers I think, but particularly for you, is there any way to quantify the extent of that phenomenon and factor it into our calculations? Because otherwise there's a concern that we're not comparing the same thing before and after a change.
Yes, I think you're right. I think it is a challenge indeed, and I think it may also it can also give us a hint on why there is this increase in problematic cannabis use, because maybe people are more open now that they have access to a legal store to say, yes, this is how much I smoke or how much I consume cannabis. But I'm afraid I don't think personally I've found a way to correct that. I don't know if any of you have an insight, but I don't.
Thank you. We have one more last question, and then we have to move on.
Hello, thank you very much for this presentation. Could you please explain a little bit what type of strains and how people are accessing different strains? My understanding was that the pilot study works with designated growers, and these then distribute to the pharmacies or depending on the canton. Could you explain that briefly, please? Thank you.
I'm sorry, I'm a bit confused.
Yes. So my understanding is that the pilot study has identified a number of growers. It's not the pharmacy who grows its own, or
Yes.
the association or social club which grows its own. Is that correct? Yes. So can you explain a little bit how the choice of strains is being decided, if it's not, if it's a market approach, if it's being inputted from the members themselves, which strains they would like to consume? Thank you.
So actually, so we have two producers, so one in Geneva, one in a canton close to Geneva. And these producers were chosen by the Federal Office of Public Health. And in Geneva, we have something that is a bit different than the other pilot trials, is that we have that our offers of cannabis products change. So you may be used to something that is 16% of THC, and if there is like a high demand that like consumers want to have something different, they can ask, and then the association sees if it's possible or not. So no, on plant varieties as well. Yes. So they have a say, but it's not guaranteed that it's gonna work their way. No, it's only two producers for Geneva and another pilot trial in Lausanne. And the German-speaking part, they have their own producers.
Thank you. Thank you so much. We will now go on to Dr. Ingo Michel. He is working for the Institute for Addiction Research and holds a long experience from various positions internationally and the national field. And he has the longest title today. So I guess you all had time to read it. The floor is yours, Ingo.
Well, I try my best to give you an overview on the cannabis legalization process in Germany in 10 minutes, because this was the process of, how to say, more than 30 years. We started 1993 with a national conference on, with a low threshold service organization, AIDS service organization in Berlin, in Hamburg, no, in Berlin. And asked for legalization of cannabis at that time. What was the reaction of the government? A long period of stagnation and basic assumption. Narcotic Act has a general preventive effect. Reality was this: the offenses had been increasing. Also, with cannabis, and also cannabis consumption had been increasing in the last 10, 20 years, 30 years. So that does not have any effect. Then we have at that time I worked also for the Ministry of Health, no longer for the NGO, and we asked for an overview on the cannabis, scientific research on cannabis. First of all, there was a cannabis production of for the medical association, and said, yes, there can be problems when the people starting very early have a high potency of cannabis use, doing it in a daily basis and on the long period. But on the other hand, then it was also 2018, the review process of the WHO. It was quite clear, and it came to the same effect and the same results. So it can be harms but mostly for a small percentage of people. Most of the people don't have any problems with using cannabis. Anyway, this was and also you might know this guy, David Nutt, who worked for the British UK government. He was thrown out because what he found out was cannabis is not the most important problem when you compare these substances, but the most important or dangerous problem is cocaine and crack and alcohol and tobacco, not cannabis. Anyway, that was really a surprise also for us working in this field for a long period, that 2021, the new government, the new coalition of the Greens, Social Democrats and the Liberals decided we want to legalize cannabis and want to open stores for cannabis, providing cannabis for adult people. That was also a surprise for us. Anyway, then we started, and this then appointed was Burkhard Blinert, is a social democrat. He was appointed for the so-called drug commissioner or drug czar in some countries, and he had been a politician for a long period and has been also worked in the Social Democratic Party to support cannabis legalization, and that was a very hard debate in the Social Democratic Party to convince them. He was in Uruguay, he was in the United States, he was in Canada to look what is going on there, and that was the basic. He wanted to start with cannabis legalization and opening a process of debate. And there had been some meetings on a European level. We hear about it in Malta, but also in Luxembourg first. And he wanted to try to get like-minded states together to help to be a European project, and Czech Republic as well. And then we have also a long ideological debate, because the Conservative Party is always against and said, no, we want to, it's a problem for the young people. And you see here, Bavarian politicians are organizing the mass, toxification of people in this Oktoberfest. The same people are said, cannabis is a very dangerous problematic. And then there came also cannabis as medicine. It has been integrated in a narcotic law in 2017 when I was in the ministry, but now it's no longer a narcotic. So cannabis for medical purposes is easier to get and to be available in pharmacies and by medical doctors. And we had the process, and it was a process of 2 years from the starting phase to the end and to the decision of the parliament. It was a big majority in the parliament voted for cannabis legalization in this regard now. And what is in the law? It's more complicated, but this most important is to allow cultivation of 3 cannabis plants and for people who resident German people or people who living in German cities. It is permitted to possess cannabis up to an amount of 25 grams per adult, and in resident also 50 grams. It's quite a lot, I think, yes. Anyway, also cultivation is accepted in non-commercial cultivation associations. They don't like the term social clubs in Germany, but it's like this. And the idea of the project to health protection, especially for young people. And this is what German people think about it. In last year, the majority had been in favor. After this debate in the parliament, no longer the majority is in favor for this, but when you look to the left side, the young people, more than 70% of the young people are in favor for this new law. But when last week there was a debate because the coalition broke down, we have new elections in February next year, and the Christian Democrats already said, when we will win this election, we will reverse this law. And the majority now in our population is in favor for reversion. This is strange, to change the meaning of the people on this regard. And here you have an overview on the cannabis social clubs, 226 applications end of September. but only 40 has been cannot start, and one has already started. And also this double standards, those who are drinking alcohol in a very dangerous way, I guess, are against this. And yes, here we have now, starting with the election campaigns already, and Mr. Merz, he might be the next chancellor in Germany, already said, no, we will reverse this law. But unfortunately, he has to be a coalition with the Social Democrats and the Green Party, and we hope that he will not succeed in this regard. Anyway, and we have, of course, in Germany, a long tradition with the so-called evidence tools for prevention and treatment for cannabis use disorders. So it's nothing new. We used here the Canadian harm reduction measures and translated into German. So we will see what will happen. But we have also a coalition, several German cities. It's just Frankfurt, Hanover, Hamburg, Bremen, Berlin, even Munich and Wiesbaden. They're planning pilot project, maybe like that one in Switzerland or in the Netherlands. This will be, for licensed cannabis stores, because this part of the law has not been implemented now. So the cities want to do some pilot project, and it will be hopefully licensed this maybe today or tomorrow by the Federal Agency for Agriculture and Food. This is responsible, no longer, it's not narcotic law now. We will see what is happening. So, of course, we have been, I will finish now. But anyway, I think it's a very big step, although when you look to the details of this cannabis law, it's very complicated and it's very difficult to control. Anyway, it's a very big step forward, especially if Germany will succeed in this. It will be, I think, it will be helpful for other countries in the European Union to go into this way, like Portugal, for example, of course. Switzerland is not part of the European Union, sorry, but at least Malta has already, also other Netherlands. You have also difficult political situation in your country. France will follow 10 years later, I guess. But anyway, so it's a big step forward, and I hope if you want to be, when you get more information on the details, please contact me and I will provide this information. Thank you very much for your attention.
Thank you very much. It will be very exciting to follow the next election then in Germany to see if they can just reverse everything again. But I guess it also puts a lot of stress on actually implementing it if there's so much resistance. Any questions from the audience?
Hi, thanks. There's this constant tension between, what happens in legalizing cannabis and in the state level and as opposed to the three conventions which basically say you can't. The states can't, the UN states cannot allow the regulation and the selling of cannabis. How was it resolved, if it was resolved in Germany in that sense, if you know? Did they just say, okay, we never heard of the convention, so we just keep moving on, or?
What's the question now?
Okay. The conflict, between the legalization and the UN conventions prohibiting selling of cannabis.
Well, UN convention does not prohibit the cannabis legalization. That's clear on one hand. On the other hand, Uruguay doesn't care about UN conventions, and Canada as well not. Germany, we have this debate, especially when concerning the second part of legalization, these licensed stores, because we already know that the European Union has some problems with this next step. We have now a new EU Commission. We don't know what is happening when this law will be, when we will be asking the European Commission, is that in accordance with international law? We don't know, but we started with this, and I think, I'm pretty sure that we will succeed, hopefully. Dirk, we don't succeed?
We will. Hi, I'm Dirk from Germany, German AIDS Organization. May Ingo allow me one additional comment? The new law exists since April this year, and last week we got a meeting with a lot of drug services who provide counseling for younger cannabis users, and they got the first data, what happened after the legalization process. And they said that much more younger people come into drug services to ask for counseling and information after April, because now cannabis is legal and they are doing nothing which is prohibited or forbidden. And that is the first data we see about the success of legalization, that more younger people ask for services, information, counseling, and help.
Yeah, but I have to mention that, okay, more people ask for discussion or for information on this, but we have also some certain data. It's not because the opposition says if there's the legalization, the people who are using cannabis will increase rapidly. This is not the case in Germany.
We have one more question, and then we have to move on.
Hi. In America, after cannabis got legalized and cannabis products started being sold, started noticing very big quality control issues, that cannabis laced with heavy metals, grown in weird conditions, etc., etc. Is there a plan of like what quality control is going to be like in this world where cannabis products will be sold, and who is going to be doing that quality control? Like the Food Administration, the drug, like how is it going to be handled as a product?
Well, we have already many organizations who the planting cannabis cultivation is allowed, especially for medical purposes, and so we have enough opportunities to provide cannabis for these purposes as well.
I'm sorry, we have to move on, so please just save your questions. We have one more speaker, and then there will be a Q&A session. Our last speaker is from Malta. Dr. Joey Reynovella is a lawyer, and he has been a major contributor to the Maltese law on cannabis, or the Use of Cannabis Act. So he will guide us through this. Thank you very much.
Thank you so much for giving me the floor. I will try to be as respectful as possible to the 10 minutes time frame, whilst I explain, obviously, the situation and legal context in Malta. So, basically, we'll be speaking about the cannabis reform that was enacted in Malta in December 2021. We'll explain the rationale behind such a legislative change, and also we'll be speaking about the workings of the Authority on the Responsible Use of Cannabis, which I currently head. So, basically, as I already explained, the legislative reforms were introduced in 2021, and they were aimed at humanizing the ordeal that cannabis users had to go through to source their supply. It's imperative to note that this transformation did not occur in isolation. Rather, it continued to build on the milestone that was achieved in 2015 by the enactment of the Drug Dependence Treatment, Not Imprisonment Act. And this reform was introduced due to several factors. So it was not introduced by chance, but rather due to several considerations. First and foremost, both local and international studies consistently showed that the use of cannabis continued to increase throughout the years, and therefore that showed and signaled that a prohibitionist approach to the cannabis use was not working. Therefore, we needed to find an alternative route of how to address cannabis use and cannabis consumption. Also, it is important to state that in the year 2020, at United Nations level, the Commission on Narcotic Drugs also removed, following recommendations by the World Health Organization, cannabis and cannabis resin from Schedule 4 of the 1961 Single Convention on Narcotic Drugs. So therefore, that also indicated a shift towards the need for more rational regulations and legislations. So, as already stated, the reform was aimed to allow users to procure cannabis in the safest possible manner. The reform caters for decriminalization, caters for depenalization, and also establishes a safe and regularized route from within which cannabis users can obtain quality-controlled and quality-tested cannabis. First and foremost, decriminalization, possession of up to 7 grams of cannabis in circumstances which show that that possession is intended for personal use has been decriminalized. So therefore, if any police officer in Malta stops you and you are caught in possession of cannabis up to 7 grams, then you would not be liable to confiscation, not liable to arrest, and you would not be liable to legal and judicial proceedings. Amounts varying between 7 grams and 28 grams would lead to a depenalized offense. So therefore, in that instance, although the cannabis would be confiscated, you would not be prosecuted in a criminal court of law, but rather an administrative fine would be imposed by a commissioner for justice, and the treatment or care plan may be imposed by the said commissioner for justice. The reform also introduced the concept of home growing, and indeed, nowadays, in Malta, residents can cultivate up to 4 plants at home, and they can keep at their premises not more than 50 grams of dried cannabis. Let us not forget that this is intended as a measure for personal consumption, and that is why the 50 grams limit. Otherwise, if any individual does not have the time or rather the liberty to cultivate cannabis at home, he now has the option to join a Cannabis Harm Reduction Association, which is licensed and regulated by the Authority for the Responsible Use of Cannabis, and from there he can obtain quality-controlled and quality-tested cannabis, which is free from harmful contaminants, which is usually found in products sold and trafficked in the illicit market, and there are certain limitations. So basically, any member cannot obtain more than 7 grams per day and not more than 50 grams per month of cannabis from these Cannabis Harm Reduction Associations. The last point is referring to the Authority for the Responsible Use of Cannabis, which is tasked with a twofold approach. So the ARUC is basically tasked with being the regulator, that is issuing licenses and monitoring the operations of licensed associations, and also to serve as an educational hub within which the general public users are educated about cannabis use, and we conduct educational campaigns both from a preventive point of view and also from a harm reduction point of view. So the Cannabis Harm Reduction Associations are groups of individuals who share costs to cultivate cannabis for their own consumption only. So this is a very interesting point. Cannabis Harm Reduction Associations are not owned by individuals, but rather they are owned collectively through the members. And this goes to show that this was intended to serve as a means where one can feel a sense of community and members can feel a sense of empowerment. Indeed, yearly elections are conducted and administrators are duly elected and appointed. And this also reaffirms the need for those administering these associations to work for the interest of the members and not for their own personal interests. The first licenses for the setting up of the associations were granted in 2023. So far, we have 11 associations which are currently in operation. So basically, distribution in Malta has already started. And as I said, associations are owned by the members collectively. They are elected as administrators on a yearly basis. Prior to issuing any license, rigorous due diligence is conducted on the administrators to ascertain that they do not have a past of irresponsible behavior. And the ARUC obviously does its regulatory role by constantly monitoring the operations of the associations. An important point is to note that the associations cultivate the plants under stringent parameters and stringent regulations, and we do monitor the process from seed to distribution. So there is no importation or exportation involved. It is an in-house process which is subject to very stringent parameters and regulations in order to ensure that cultivation is of up to the highest standards, and the final product is of quality. So harm reduction through cannabis associations. Harm reduction features are incorporated in all aspects of the association's operations, such as rigorous quality testing, THC limit on young adults, prohibition on marketing, prohibition on techniques which promote consumption, education on the risks associated with cannabis consumption. And this brings me to the point that the reform did not stop short at decriminalization, because whilst decriminalization is an important tool, on its own it is insufficient to address the complexity surrounding cannabis use. With decriminalization, there were organizations which were saying, listen, we should stop at decriminalization, but the government did not believe that that would be the ideal option, because by stopping short at decriminalization, the question that would be posed would be, but from where would a responsible law-abiding citizen obtain cannabis if possession is decriminalized? And by leaving that individual, that citizen, solely resorting to the illicit market would not be effective, and it would not militate in favor of a harm reduction approach. So to ensure a comprehensive harm reduction model, we have introduced these associations, and they cater for several aspects and several dimensions of harm reduction, not least from a health perspective, whereby they are now accessing quality controlled, quality tested cannabis, which is free from harmful contaminants such as synthetic, heavy metals, mold, aspergillus, and things alike, and therefore they ensure that no harm is being conducted on a health level. Harm reduction applies also on a social and emotional level, since now they will be accessing a safe and regularized route from where to obtain cannabis, and also harm reduction from a legal and judicial point of view, because now since they have a legal route from within which to obtain their cannabis, they will not be targeted by law enforcement officials, as they would be operating under legal circumstances. This is the lab testing that I was referring to. So basically, rigorous testing is conducted of every batch of cannabis produced to ensure that it does not contain harmful contaminants. Testing is conducted on TAMC, TYMC, motor content, heavy metals, aflatoxins, and aspergillus. Testing also verifies the level of THC, which ensures that users are aware of the dosage that they are receiving. So basically, it is important to have a transparent approach whereby users are able to know what product they are accessing and the THC levels that they are accessing. And as already mentioned, young adults between 18 and 21 years of age may not obtain cannabis with a THC content exceeding 18%. Promotion and advertising, they are strictly prohibited, including on social media. Associations may not employ techniques which encourage members to procure more cannabis than they need. That is strictly prohibited by the AROC. Users may obtain up to 7 grams per day, as stated, but not more than 50 grams per month. Education, it is one of the primary roles of the AROC. Awareness about the risk associated with the consumption of cannabis included in all means of communication between the associations and the members. Packaging through which cannabis is distributed to the users includes standardized labels designed by the authority, which include harm reduction messages. Associations include harm reduction messages in a prominent location within their premises, such as messages like do not mix cannabis with tobacco, do not mix cannabis and alcohol. The authority also carries out public campaigns aimed at a wider audience than cannabis users, including those who are not members of the association. Some initial results and statistics. So far, out of the 11 associations that have commenced their operations, we can see that there is approximately over 2,000 members who have registered. An initial craze by members to procure legal cannabis led to associations to quickly run out of stock. It was a situation that was faced by the Maltese associations. Although it is not yet possible to obtain stable trends about consumption patterns, initial results show that the average consumption is that of 16 grams per member per month. Average consumption is much lower than the maximum allowed of 50 grams per member per month, and lower than the average consumption indicated in scientific studies. Although further research is required, this finding is indicative that legislative reform is working as envisaged, i.e. decriminalization has not led to an increase in the consumption of cannabis. So I hope I have respected my time frame.
Thank you very much. Thank you very much to the whole panel. There's been a lot of very thought-provoking things, so I'm sure that the panel know the audience has some questions. One back there.
Hi, thank you. Really quickly, you mentioned that there were a prohibition of techniques which promotes consumption. Could you precise which
Yes.
kind of techniques you include in that? Do you mean that you can only smoke joints? What?
No, what I'm referring to is that associations cannot say contains offers like if you buy 2 grams of cannabis, you will get another gram free. So we are not promoting cannabis in that sense because.
Thank you. Anton Jassen, ChemWise, the first chemsex clinic in southern Sweden. I was wondering what happened to HHC and other synthetic brothers, but then I Googled, and then I saw your name also, but maybe the public here also would be curious to get to know how it happened, because it just, I visited it in September and it was still there being sold, but then I read 2 months ago you banned HHC. Thank you.
So basically associations cater for only natural cannabis. HAC, as you correctly stated, is a semi-synthetic cannabinoid that is not catered for by associations. Nonetheless, it cropped up in commercial outlets selling these kind of synthetic cannabis products. We have discussed this together with other entities from different ministries in Malta, and on the 26th of September, if not mistaken, we have issued a legal notice by virtue of which we have banned HHC. Obviously, we are coordinating with relevant authorities and relevant entities so that we can conduct enforcement on such commercial outlets to really ensure that HHC products and other derivatives alike are not being sold over the counter.
Can you hold the microphone very straight? Because if you go like this in the sun,
Yes. I like to move a lot.
Okay, we have a question from Switzerland.
Hi, thank you. I'm also part of a pilot project, but in the German-speaking part of Switzerland. And I have a question for all of you. To summarize the panel, I would say cannabis is not the main priority in terms of harms and risks, but it's the main priority in terms of regulation. So my question is, how do you see it? Isn't there a risk that this straight focus on regulating cannabis some kind of covers the general debate about regulating substances? Because we had heard a lot of debates in Switzerland. I don't know how you are attracted by a lobbyist organization. They tried to argue for a new distinction between so-called hard and soft drugs, and yes, important to regulate cannabis because then a cannabis user don't need to go to dealers where they have hard drugs and stuff like that. So isn't there a risk that this heavy focus on cannabis regulation is some kind of undermining the debate about regulating substances in general? You know what I mean with my question? It was not easy to explain.
That's okay.
Even for myself, actually.
So maybe if I can try to address the question, I don't know whether I understood correctly, but I understood the question as why are you focusing on cannabis and not other harder drugs? Is that right? Is my interpretation correct?
No, maybe yeah. It goes in the right direction, but isn't there a risk that if we are talking or focusing on a substance that doesn't harm that much than other substances, that we don't are able to talk about regulation in general, because the focus is so much on cannabis and the debate goes to like cannabis is not that harmful, that's why we want to regulate it. But shouldn't we rather talk about regulating substances that are more risky? That was my question.
So I will answer from men and then I will pass the microphone to...
Maybe for the coffee break.
Yes, we could.
Maybe I can respond to it, because my point was actually the opposite, that cannabis regulation might open the debate for regulating other substances, and I'd say it's already happening somehow, you know, because we have so little data about what is actually going to happen if you start legalizing substances. that I think in the cannabis space is where we start to see these first data. So I think in that sense it's already happening, that it's being used like, but if you legalize it, won't you have more people that will have access to it and start using more, you know? So these types of questions we can start to answer, but yeah, just the first reaction. Yeah.
Thank you. We have two more. I couldn't quite see who of you were first. So the lady goes first, or no, the man in the back? Ta han først og så. Yeah.
Just very quickly, tomorrow afternoon there's a satellite conference on regulation, and we're going to be focusing on cocaine. So the debate is happening in other drugs that are more risky and in many ways more challenging in terms of figuring out regulation. And yeah, please come along and we can explore that difficult question. But the question is being engaged with. It's not easy, but it is happening.
Part of the event is also regulation of other substances, new psychoactive substances like kratom, HHC in Czech Republic. So come, please.
Awesome. Yeah, first of all, thank you to the panel. This was really great. I'm glad the point about synthetics was brought up just now too, because I wanted to ask a question about how we're measuring harm. Specifically, we're talking about illicit market versus licit market, because I feel like from what I gathered, a lot of the measures are focusing on THC levels and maybe frequency of use, difficulties resulting from use. That makes sense, and that's really great. At the same time, when we're talking about the comparative harms between illicit and illicit market, I think the point's missed that on the illicit side, there's often contamination with synthetic cannabinoids, which we know have different and often more potent consequences than cannabis, which is a long way to say that when we're comparing the harms, we might not be comparing the harms of the same drugs. And so I was wondering how this is accounted for in the research paradigm, or maybe into arguments about regulation in general. Thank you.
Yeah.
Regarding the German experience, I guess the same as you mentioned, it's a starting phase for debate on other substances, and all the organizations working in this field will follow this way and will look, and as you mentioned also here, no promotion, it's very important to harm reduction measures will be part of this regulation system, and it will be, I think will be showing that it is working. On the other hand, the biggest problem in Germany is now the medical associations. The Association of Medical Doctors are still against, and politicians are really listening to this Association of Medical Doctors, so we have to convince them as well, not only politicians. I don't know how is it in the Netherlands or in other countries or in Switzerland.
If I may add a point to the question that was posed by the gentleman, the Authority for the Responsible Use of Cannabis in Malta is in the process of finalizing an agreement with the University of Malta in order to start conducting research, amongst others, research on a comparative analysis between what is being distributed within cannabis harm reduction associations as opposed to products that are being distributed or rather trafficked in the illicit market. So basically, the University of Malta has a laboratory which is frequently engaged by court officials in court cases dealing with trafficking of cannabis, and from the results that they compile on this cannabis products that is that is confiscated from the illicit market, we can conduct a comparative analysis to effectively show what do we mean by a harm reduction approach. This is what we mean by harm reduction, that if you are accessing a cannabis product that is distributed by cannabis harm reduction associations, you have your mind at rest that that is not contaminated with synthetic, with heavy metals, etc., as opposed to the illicit market. So that is something that we intend to do in order to show the public that this measure, this reform, is really an effective measure of harm reduction.
There was a question. Yeah, great.
Thank you. Yes, I would like to make two observations more than a question. First of all, thank you to the panelists for this very fruitful presentation. However, I wanted to please underline and remind everyone that most cannabis reforms were initiated by civil society. It's something which we did not hear here. We are here for a conference by civil society. And in the case of Malta, for example, it's important to highlight the role of Relief Malta, who is the only NGO representing the voice of people who use drugs, who worked very hard for this reform to get through. And I am sure also in Germany and other countries, the role of civil society was central to not only change hearts, but also convince politicians on the importance to move to a regulated framework. And apart from that, something which I am observing in Europe, missing pretty much differently from the US, is a discussion on restorative justice and social equity. There is a possibility that the new regulatory frameworks act as a act negatively on certain communities which were already negatively impacted by prohibition. And throughout Europe, unfortunately for now, the focus has always been on health, health, health. And maybe it's time to also start considering restorative justice as an important tool to further promote a harm reduction approach. Thank you.
Thank you. I think there was a question, yeah?
More or less observations as well. So the first note is to the first presenter, Thomas. Yeah, we spoke about smoking and alternatives and edibles, for instance. Now I'm speaking not as a professional in working with drugs, but as a consumer with experience of both problematic use addiction. Now, after 2.5 years of quitting my 10-year addiction of marijuana, my main drug of choice in life, I explored by help of my partner, drinkables. And it's probably the most safe way to consume marijuana because it also allows you to control your affect and dosage in much more, even in a better way than the edibles. Then the second note, I think, to the French speaker for the project. Now, as a professional in Sweden working with chemsex practitioners, we do observe that marijuana can be a substitute substance for quitting harder drug. I know basically few examples of very happy ending of really hard addiction on GHB, GBL, and some other substances, thanks to cannabis. The third note to the last speaker, Joey, I think I want to do this reform in Sweden. And the last note, thanks, Karen. Civil society needs to be appreciated for this fight for decriminalization. Thank you.
One thing I found really interesting when looking at all these international developments was that home growing was often the first step towards legalization. Well, if you look at the goals of policy, improving the quality, making sure that it doesn't end up in an illegal market, then home growing is not the best way to do it, I guess, because you have no control. And also, in terms of things that don't make sense, is if you look at the possession rate, which is, for example, 50 grams in Malta, 35 grams in Germany, if I remember, 50. And I've grown cannabis, one plant, it was almost 300 grams. So even if I grow a plant, it already doesn't make sense. So I don't know if you could maybe think or comment about it. Why is this? Seems like a low-hanging fruit, but it doesn't make sense considering all these policy goals.
Maybe if you allow me to start. So I want to join Ms. Karen Mamo in thanking civil society for their contribution towards reforms. And indeed, to answer your question, home growing was something which civil societies in Malta, for example, they advocated hugely for. So it was a way of addressing that concern. And to answer your question about, there's this debate in Malta about the amount of grams that can be kept following cultivation of cannabis at home. Basically, the Maltese legislation offered the opportunity for individuals to cultivate at home, but obviously under the parameter that that cultivation has to happen for personal consumption. So therefore, I totally understand your concerns, but anything above 50 grams that would be cultivated would need to be destroyed, because otherwise then that would not militate in favor of personal consumption. And that is precisely why the Maltese model went a step further by creating a robust regulatory system to ensure safe, controlled access to cannabis users, so that they may access cannabis product that is quality tested, quality controlled, without the need of going into the hassle of cultivating the cannabis plant at home. So that is from my
Maybe one comment, because I think home growing is a very important step to give the responsibility to the users, not to the associations, not to the medical association, but to the users themselves. On the other hand, in Germany, concerning the use for medical purposes, first it was the decision of a court, because in the Ministry of Health, when I am working, the bureaucrats had been against home growing. It was a court decision which said, if you don't change this law, we will allow a patient at the time to grow it by himself. So it was the decision supported by law, by courts in Germany as well. That was the first step.
Thank you. This has been a very interesting session for me, highlighting a lot of different sides of cannabis policy and user experience. And I would like to thank the panel so much, and a big applause for them.